All right. Good morning, everybody. Thank you so much for showing up and spending some time with us this morning. This is a public hearing for the Medicaid Transformation, also known as MTP, for an amendment request. And so today is the first public hearing that we have. We'll have another one on Monday the 15th. If you wanted to join in again, or if you had some colleagues who couldn't make it today, let them know. The 15th, we'll have our second and last public hearing. Next page or next slide. Okay, so before we get started, I want to go through a little bit of kind of Zoom housekeeping. We're in about, year 3 of doing all of this online meeting, so you're probably all very familiar with this, but just wanted to walk you through it. So as you likely heard at the beginning, we are recording this webinar and we have muted all attendees. And so that means that you can hear us, but we can't hear you. There's going to be a time at the end for Q&A, and we encourage you to submit your questions and comments through the chat function. And you can do this during any part of the presentation. You don't need to wait until the end to ask questions. So please submit comments, questions, concerns all throughout. And then at the end of that Q&A, we'll have some time to respond and answer those questions. So today we have turned on closed captioning for everyone. However, you might not see it on your end. And so if you do want closed captioning, please enable the live caption message, that button at the top, at the bottom of your screen. So also mentioned in the chat, thank you, Addie, for putting that in there. Our slide deck is available on our MTP amendment request page today, and we will be posting all the recordings from the hearings on that page, and we're looking to do that around the middle of this month. So stay tuned if you wanted to go back and watch, or if you wanted to share the recording with someone. It'll be available very soon. And last but not least, I just wanted to give a really special thank you to everyone who's working behind the scenes to make this hearing happen. We've got the folks who are driving the presentation. We've got folks who are, doing the technical piece behind the scenes. We have a number of subject matter experts. And then we have lovely Amy Dobbins, who's going to be introducing herself in just a moment. So thank you all again for being here. And again, submit those questions. We would love to hear from you. All right, Amy, I'm going to pass it over to you.
Great. Thank you, Rochelle. Hello, everyone. My name is Amy Dobbins. I manage the Apple Health Eligibility Policy section in the Medicaid Programs Division at the Healthcare Authority. I'm probably going to go off camera, but just wanted to come on. Maybe it'll be easier for you to see the screen here. We can go to the next slide. So today we'll just cover a few things with you. We're going to cover Medicaid and the Medicaid Transformation Project overview, give you an overview of the amendment request, how this amendment will help our state's children and youth, share a couple of statistics with you, and then, as Rochelle mentioned, we'll have some time for Q&A. Next slide. So Medicaid is a federal healthcare program which is administered by each state. It's really a partnership between the federal government and state government. The Healthcare Authority manages Medicaid and the Children's Health Insurance Program in Washington State, and we call these programs Apple Health. The federal government helps to pay for the programs and also creates the rules that govern these programs. Next slide. A state must apply for a Section 1115 Medicaid demonstration waiver when it wants to make changes outside of kind of the normal Medicaid standards or rules there. And Washington received this waiver in 2017 called MTP. The Centers for Medicare and Medicaid Services, or otherwise known as CMS, is our federal partner, and they're also responsible for approving MTP and its associated changes. Next slide. So MTP really allows our state to create and continue to develop projects and activities, including services that improve Washington's healthcare system. And all the work under MTP benefits those enrolled in Apple Health. The current MTP waiver ends June 30th of this year. And last year, HCA and the Department of Social and Health Services applied to CMS to renew the waiver for an additional 5 years. And we refer to this as MTP 2.0, MTP2, kind of the second iteration. Next slide. So HCA and DSHS are requesting an amendment of the current MTP waiver. And what we're covering here today is, if approved, this amendment would authorize a couple of things. So really it would authorize Medicaid coverage for former foster care youth, also known as alumni coverage in Washington, for youth who are coming from other states who turned 18 prior to January 1st of 2023. And I'll go into a bit more detail as to why that's important. And then the second piece here is continuous enrollment for CHIP coverage for CHIP eligible children during the first 6 years of life. Next slide. So a little bit more about the former foster care amendment. If this were approved, it would authorize Medicaid coverage for children who are coming from other states who turn or turned 18 prior to January 1, 2023. And that coverage would remain in place until that enrollee reaches the age of 26. This flexibility will provide coverage for former foster care youth who are not covered under the Support Act's mandatory coverage policy for those who turn 18 on or after January 1st, 2023. And the coverage under this waiver would apply through December 31st of 2030. We anticipate around 180 enrollees would be eligible for this coverage during the MTP 2.0 period. Next slide. So allowing access to health services for the former foster care youth ensures continued coverage as enrollees transition into adulthood. We are also submitting a state plan amendment. So these two authorities will work together, and the state plan amendment would cover foster youth from other states who turn 18 after January 1st, 2023. And that's in accordance with Section 1002 of the Support Act. And so these two combined authorities would allow Washington to cover all foster care youth from out of state, regardless of when they turn 18. So that is the kind of nuanced policy there, as we want to make sure that regardless of when they turn 18, the coverage is available to them. Next slide. So now just to talk a little bit more about the continuous enrollment request. So if approved, this amendment would allow CHIP children to be continuously enrolled until the end of the month in which their 6th birthday falls. And oops, sorry, I just had a notification here. Amendment for children ages 0 to 6 who are enrolled in CHIP with incomes up to 300% of the federal poverty level. That equates to, for a family of 3, that equates to just over $71,000 per year annual income. So we estimate that just under 17,000 enrollees would be continuously enrolled from the time period of 2024 through 2028. Next slide. So if approved, this amendment will help our state continue providing coverage and ensuring access to health care for children and individuals who are at risk of losing their health care coverage. We all know that inconsistent coverage or disruption of coverage can lead to unmet healthcare needs and delays in diagnoses, preventative services, and treatment. Children and youth are some of our state's most vulnerable people, and we need to look out and protect them, look out for them and protect them. And it's also especially important for children experiencing both physical and behavioral health issues. Next slide. Just a couple of statistics to share with you that help, I think, tie the this specific amendment request up. In December of 22, we had a total of just under 2.3 million Apple Health eligible people in Washington. And of these, just about 100,000 were American Indian Alaska Native. And gaps in coverage are really higher for children of color ages 0 to 6. For children within this group, Washington data show 4.6 to 6.3 months of disruption in coverage over that 0 to 6 time frame, or 600 months of possible coverage. With this amendment, we think we can continue to reduce disruptions of coverage, and are really looking forward to, when people have access to coverage, they're more likely to have improved short and long-term health outcomes and a better quality of life. So I think this policy will help us achieve that. And I think next slide is Q&A.
All right. Thank you so much, Amy, for all of the great information. I know we've got a little bit of a smaller crowd today, but again, we would love to hear questions, comments, anything that you may have for us. We've got a number of subject matter experts, including Amy, who are here to respond and answer. So I'm going to just give the uncomfortable silence here for just a minute, and I want to make sure that folks have kind of a chance to digest. So I'm going to just wait for a moment. And again, you can submit just by clicking on the chat feature down below in the Zoom toolbar. Okay, going once, going twice. Let me ask Amy and Chase. I know that you're also on the line. Chase Napier is our MTP director, and wanted to ask the two of you if there's anything in addition. I know that we shared a lot of stuff on the slide deck here, but is there anything that you would want to add or include and to share with our attendees today about this amendment?
This is Amy. I don't think so, other than I think both of these things are really aligned with what we're trying to do here in Washington to advance and improve health outcomes. So I'm not surprised if there's not a lot of questions, but I really appreciate the opportunity to be here and share this with you all today.
Thank you so much, Amy. And Chase, anything from you?
Thanks, Rochelle. I would just say, if you have any questions around any waiver activity, even after this call, just feel free to reach out. We'll provide our contact information, and we've already linked to our website, so you should have access to the right resources and contacts. There's a lot of waiver activity going on right now. Amy mentioned our MTP 2.0 renewal. We also just received an amendment approval. We have a COVID public health emergency amendment approval. So there's a lot of waiver activity, and it can get confusing to track the different pieces. So if you ever have questions, please reach out. But we do have a lot of really good materials on our website. We always provide summary materials, thanks to Rochelle and team, that are really digestible, easy to just kind of scan through and understand at a high level what's going on. So just wanted to mention that, and we have an open inbox, open phone line if you have any questions.
Thank you so much, Chase. And that's a great way to end. So let's go to the last slide. We have some contact information, our Medicaid Transformation at hca.wa.gov. Please reach out there. And as mentioned before, and Addie, if I could ask you to put in just our amendment request URL, that page one more time for folks. I know we had a couple of folks that came in after. And so if you check out our amendment request page, we have a full listing of all the different ways that you can provide public comment if you wish to. Certainly this was one opportunity for this public hearing, but we also have, you can email, you can snail mail us, and Tamara will gather that for us, who's one of the many people helping behind the scenes today. Thank you, Tamara. And there's lots of really great information about the amendment. And that is one page of our full Medicaid Transformation Project website. There is so many pages. There's so many great documents on there that help kind of, like Chase was alluding to, kind of just in bite-sized pieces, because MTP is very complicated and very big, and there certainly is a lot of activity that's happening. So please reach out if you have questions or comments. We always love to hear from you. And with that, thank you so much for attending and spending just a few minutes this morning with us. I hope you guys get some great weather. I know we've had some really beautiful sunshine here on the west side of the state. So take good care, and we'll see you soon. Thank you so much.